Hello, everyone. Welcome to another special webinar for our students. We are still on Pulse Diagnosis Made Easy, and for today, we shall be discussing the elements of the pulse image. Okay, when we look at the ancient books, when you read the ancient books, they would actually summarize all the pulse images into four aspects: the position, the rate, the shape, and dynamic. In modern times, we divide the pulse into eight aspects: position, rate, length, breath, strength, fluency, tension, and uniformity. So we shall be discussing each one separately. Let's start with position. So with position, this is how it should look like. How the pulse should be felt. So normally we should feel the pulse at the middle level. Okay.
Mhm,
How do we define position? This is the depth or the
mhm,
shallowness of the pulse.
mhm,
So that's why we have a floating pulse and a sinking
mhm,
pulse. So
mhm,
that's position. Depth or position refers to the location where you have to feel the area, the location where you feel the pulse as strongest. The normal pulse should be mainly felt in the middle depth. Please remember this. What does this mean? This means that there is enough stomach chi and
mhm.
shows that the chi and blood of the body can flow freely from interior to exterior as well as to the xanth organs. So I have a question
Mhm.
for those who are noisy. Okay. Sandali.
Di ba? May discount na yun.
Okay. Naririnig natin. Okay. So, where were we? So how would you know through the tongue if the stomach chi is sufficient? Anyone? Would you still be able to see the coating?
Yes.
Yes po,
So, ano yung
Yes.
coating? It should be thin.
madila.
Thin
Ano
white
daw?
coating.
Same one.
Thin white
Normal lang.
coating, not thick. Okay na. So that's the position. Next element is the rate. This refers to frequency of the pulse beating. So we have such thing as slow pulse and rapid pulse. So how do we quantify it? Uh, the normal pulse rate should be 4 to 5 beats per respiratory cycle, and this is one breath of the practitioner. But again, I don't think this is very reliable. Do you agree? Because if the
Yes.
practitioner is having issues,
Yes.
Mm. Baka siyang nagpa-palpitate.
so what do you think would be the most reliable technique, especially these days? Uy, isip naman kayo.
Yung nga
Wristwatch. I
Yeah, your watch. Your
yeah, the watch.
so 15 seconds. Take it at 15 seconds. Just try to look very professional. 15, then you multiply it by 4. Okay? So the normal should be, so obsolete na po ito ha, 4 to 5 beats per respirator. Kasi sometimes your breathing may be, ano no, may be harsh or
Mabilis.
mabilis. So it's not reliable. So 60 to 90 beats per minute. Okay, the pulse rate is determined by a number of factors, of which the state of the young plays a leading role. Why? Because this governs the movement of the blood via the lung and heart. Next, length. Okay, when you talk about the length, you're actually referring to how uh, it should occupy all the three positions: distal, middle, proximal. So again, this is so difficult, right? Ano, not really, but kasi like if you have a small, a very petite patient, you'll probably have to do something about the pulse. So the length means the longitudinal range of the pulse beat. So we have long pulse and a short pulse. Okay, so obviously pag long pulse, it would exceed na this one. 'Di ba? The Tsun Guan Shi. The length of the pulse is a measure of its length in relation to the three positions. The normal pulse should be felt at the distal, middle, and proximal, and should be neither too long nor too short. So what determines the pulse length? The chi and blood, of course. Actually, in reality, when we check the pulse, it actually reflects the heart chi. However, in Chinese medicine, before the heart is affected, we need to make sure that all the other organs are in good working condition, right?
Yeah.
So since it is the chi that will make the blood move, um,
Mhm.
chi really plays a major role in the length of the pulse. Obviously, if the chi is very weak, you wouldn't be able to expect the all three positions to be filled out. No?
Mhm.
So that's the length. Now let's go to breath. Breath indicates the range of the pulse as it relates to the thickness or thinness of the beat. So that's breath. So think of the diameter of yun ba yun? Yeah, the vessel, no? Of course, if you have a
Mhm.
surging pulse or a thready pulse, so it's like thready, parang sinulid, that's the opposite of surging pulse. So the width of the pulse is the diameter of the vessel. The diameter of the blood vessel depends on the qi and blood again, which reflects the
Mhm.
condition of the Zangfu organs.
Mhm.
When the internal organs are healthy, the blood vessel's diameter is in a normal state. Normal pulse width should be moderate, neither too thin nor too wide. So breath. Let's now go to the fifth one, the strength. Actually, this is the reason why we should take the pulse. Okay. Di ba, like when you give a diagnosis, when you formulate your diagnosis, you have to make sure ano ba, excess ba or deficient. So when you say
Mhm.
strength, it means the strength of the pulse beats. So we have a deficient pulse, we have an excessive pulse. Okay? So this is the beating force beneath the finger. The normal pulse should beat with a moderate strength. It should feel gentle and soft, neither too forceful nor too forceless. The strength of the pulse
Mhm.
reflects the condition of the chi and blood. Sometimes we may have a difficulty ascertaining whether it is deficient or excess, but again, you need to make use of your tongue diagnosis. Diba?
Mhm.
Fluency refers to the degree of ease of the approaching pulse, such as slippery pulse, choppy pulse. So if it's choppy pulse, there's something that's blocking it, no? Slippery naman, it's too madulas. So that's the fluency. So this actually refers to the shape, right?
Mhm.
The waveform or contour of the pulse. The
Mhm.
shape of the normal pulse refers to the rising and falling of the vessel as the blood flows
Mhm.
through it. Are you with me? Pulse beat is
Yes.
composed of two periods. Of course, kung nag-a-ascend siya, magdi-descend din siya. In a normal pulse, the rising and falling are about the same. The condition of the blood vessels, of course, chi and blood again, will determine the pulse shape. Number seven is tension. This is the degree of tightness or slackness of the vessel, such as with a wiry pulse, tight pulse, and a moderate pulse. Okay?
Alam.
This refers to the
Mhm.
tension of the blood vessel, called vasotonia. Normal pulse should be neither too taut nor too slack. The tension of the blood vessel is predominantly, again, manifestation of the chi and blood and the condition of the blood vessels. Ganun lang, chi, blood, blood vessel. And lastly, the uniformity. Okay? It doesn't mean only missed pulse beats. Okay, yung mga may heart issues, you should be very careful,
Mhm.
especially if you're already aware. You would miss some pulse beats. No? You would be able, yeah, yung mayroon silang arrhythmia. Katulad ng isa kong
Mhm.
patient, meron pala siyang AFib, no? Atrial fibrillation. So, nabias na ako. So, I became more conscious. And also uniformity of consistency of the pulse, like hasty pulse, knotted pulse, intermittent pulse. So, all of this, uh, we shall study in the future. Okay? Ano ba yun? Parang nanggaling pa sa... Wait lang. Ay, dumadami tayo ah. Sige, sana hindi na bumalik. Okay. Every pulse image can be analyzed and described by these 8 features. Okay? So, yun. Yun na yun. Any questions? Nobody interrupted me. Ay, mayroon pa pala. Rhythm is the pattern. Ito po yung regular rhythm. Regular. So, a normal pulse should beat with a regular rhythm. Okay, maybe you should ask the question, how long should we check the pulse? Ang legit talaga na pag-check ng pulse is 2 to 3 minutes. Huwag naman yung pag mo pa lang, alam mo na kaagad. Imposible. Okay? So the rhythm of the pulse is mainly a manifestation of the heart chi, since the heart chi commands the blood to move through the vessels. The function of the other organs play a less role in the rhythm of the pulse. So I hope that was okay.
Lakad tayo, ma.
Pwede kami sumama. Okay. Pula tayo. Okay, let's... I request the Mom Tricks to assist us for the assessment. Okay.
Yes, Doc.
Thank you. Can you describe a young pulse?
It should be strong and forceful.
Yeah. What else? In terms of depth, yeah.
Yeah.
Floating.
Floating.
Yeah, superficial. Ano pa? In terms of rate.
Norm. 40, 4 to 5 beats.
Yeah, rapid. Yeah, rapid
Yeah.
siya. 16, okay.
For
What about
respiratory side.
the length?
Um,
Alam na natin yung length, it occupies all the 3 positions. Should it
sorry.
It's
should it
long.
be sobra?
Low.
Long.
Normal.
Long.
Long.
Long siya.
Long.
Any comment? So alam nyo na. So ang yin pulse is opposite. Okay. Yin pulse, who would describe?
So
Ma'am,
weak or soft.
yes.
Weak or soft.
Um,
Um,
weak, deep,
deep.
slow, short. Okay?
Short.
So pag sinabing short, it doesn't really
Yun eh.
fill out all the 3 positions. Okay? Weak,
Ay.
deep,
Or
slow,
palaya kapag
short.
Ayun.
What is
Short.
a simple pulse?
Simple pulse is a pulse that is straightforward and easy to interpret. Indicates the chi and blood flowing well.
So there's only one factor that you have to consider. Complex,
Characterized by multiple layers or irregularities and different to interpret.
very good.
Mm-mm.
What does superficial pulse indicate? Or what is the clinical significance of a superficial pulse? Is it a normal thing?
No.
Is,
Okay.
is it, it's a floating pulse indicating an external invasion, yin deficiency with yang floating upwards, or qi or yang deficiency.
Huwag mo na
Dami yan.
isipin. Exterior siya ng deficiency patterns.
yun ang yung deficiency.
Kasi especially when you have
Oh,
in empty heat, right? Empty heat. That's the deficiency. Deep pulse indicates,
An interior pattern.
yes, very good. A slow pulse
Cold syndrome.
and yang qi deficiency.
Yang qi
Mahina yung
disease.
qi. Fast pulse
Um, Indication of a heat syndrome.
Okay. The pulse should be 90 to 140.
Mm.
Yun. Excess pulse.
Um, it's a excess
Rapid pulse.
condition where both pathogenic and anti-pathogenic factors are strong.
Okay.
Mm-mm.
Yes. Especially yung mga young individuals, no? So
Mm-mm.
there's a war going on. Lumalaban pa. And deficient pulse.
It's a chi and blood can be damaged by summer heat.
Okay. Deficiency. Weak and wide on all three positions. Thank you so
Mm.
much, Mom Tricks.
Thank you, Doc.
I hope you enjoyed this as much as I did.
Yes.
Okay, any questions before we move, before we go? I know it's a little bit simple, but sometimes you forget, diba? So this is very basic. Any comment, Dr. Janine? Let's not talk about MPV or the monkeypox.
Wala, Doc. No comment. No monkeypox.
Okay. No, that's why I will not talk about monkeypox. Let's talk about the pulse. How do you like our series, the pulse lecture series so far? Ay, no comment.
Doc, nagcha-choppy-choppy yung internet dito.
Ay, okay.
Mm-mm.
Malamig yata dun sa kanila
Oo
eh.
nga. Oo, sige. It's okay, Doc
Mm-mm.
Janine.
Hindi, nag-sweep out ng mga cables. Nagsisweep out ng mga cables. Since then, nagcha-choppy-choppy siya. Ewan ko ba?
Okay.
Hmm.
There was a time choppy dito nung pero ewan ko lang. Okay, so yun. Any questions from the class? Let's call on those people from... Sige, let's get to know each other muna, no?
Grabe man.
Thank you so much for joining. I-end ko muna.